Bismillahirrahmanirrahim. In this video, we'll discuss how to switch among anticoagulant in one based approach. And we'll start by looking at if you want to switch from the vitamin K antagonist to the new oral anticoagulant. This is the vitamin K antagonist, and this is the new oral anticoagulant. If you want to switch between vitamin K and from the vitamin K or warfarin to the new oral anticoagulant, we stop the vitamin K antagonist. Then we wait till the INR is less than 2. Then we start the new oral anticoagulant. The second thing, or second situation, if we want to switch from the new oral anticoagulant to the vitamin K antagonist. And in this case, we have two approaches to do that. The first approach is here this is the new oral anticoagulant. We will overlap by combining the new oral anticoagulant and vitamin K antagonist. Here the two drugs are running together. Then we stop the new oral anticoagulant after 2 to 3 days or after the INR reaching more than 2, and we stop the new oral anticoagulant and continue with the vitamin K antagonist. This is the first approach. The second approach is to stop the new oral anticoagulant. Then we combine low molecular weight heparin with vitamin K antagonist till the INR is more than 2. Then we will stop the low molecular weight heparin and continue with the vitamin K antagonist. If we want to switch between two new oral anticoagulants, we just stop the new oral anticoagulant, the current new oral anticoagulant, and start the new regimen. At the same time, the next dose of the new oral anticoagulant is due. And by the same token, if we want to switch between the new oral anticoagulant and parenteral anticoagulant, we just stop the new oral anticoagulant and we'll start the parenteral anticoagulant at the same time the next dose of the new oral anticoagulant would have been given. If we want to switch between the subcutaneous low molecular weight heparin and new oral anticoagulant, the same thing, stop the low molecular weight heparin and start the new oral anticoagulant at the same next dose of low molecular weight heparin would have been given. If we want to start or switch between IV high molecular weight heparin and new oral anticoagulant, the same things. If you continue with the IV heparin infusions like that, just stop the infusion and start immediately the new oral anticoagulant. And lastly, if you want to switch between the low molecular weight heparin and vitamin K antagonist, here this is the low molecular weight heparin. Then we need to overlap between the low molecular weight heparin and vitamin K antagonist until the INR is more than 2. Then we will stop the vitamin K antagonist. Let us take some example to illustrate this approach. If we have 40-year-old male patient have an atrial fibrillation and this patient on warfarin and need to switch this patient to the new oral anticoagulant. So this patient is on vitamin K antagonist and need to switch to new oral anticoagulant. When you stop the vitamin K antagonist, check the INR. If the INR is less than 2, start new oral anticoagulant. This is the first case. The second case, 35 years old female patient. She has DVT. She's on low molecular weight heparin, and we need to switch to the new oral anticoagulant. This patient is low molecular weight heparin, stop and start new oral immediately at the same time of next dose of low molecular weight heparin. So if we stop the low molecular weight heparin for example, we give the morning dose, we'll start the new more oral anticoagulant in the evening at the same dose that we shall give the low molecular weight heparin. If the third patient is 65 years old male patient, the patient has an AF and he was on new oral anticoagulant. But this patient will undergo mitral valve replacement and need to switch from the new oral anticoagulant to the vitamin K antagonist because the new oral anticoagulant is not indicated in the mitral valve replacement. So here is how we can take it in two approaches. The first approach that this patient on the new oral anticoagulant, we start with vitamin K with new oral anticoagulant, then the INR more than 2, we'll stop new oral anticoagulant and continue vitamin K. This is the first approach. The second approach that we will stop the new oral anticoagulant and we'll start vitamin K antagonist with low molecular weight heparin. Then we, until the INR is more than 2, then we stop the low molecular weight heparin and continue with the vitamin K antagonist. For further reading, you can check this reference. Thank you.